Hi, I'm Dr. M, and today we are going to talk about acute blood loss anemia. Let's break it down step by step and make it simple to understand. Okay, here's a post operative case. Hemoglobin before surgery was 14. Within a few hours, it drops to 8.2. So the blood transfusion is given. But documentation says only anemia. And that's where the problem starts because this is not just anemia, this is acute blood loss anemia. And missing the diagnosis means missing the true severity of the case and even impacting reimbursement. So let's understand the logic behind it. Okay, so acute blood loss anemia happen fast within hours today, not like chronic anemia which develops slowly over month. Okay, so patient loses blood rapidly, hemoglobin drops. Intervention is required, and this is why this is considered a very serious clinical condition. Now let's simplify this with one rule, 289 rule. These are the three number you need to remember. First, a drop of 2 or more in hemoglobin. If hemoglobin drops by 2 gram or more from the baseline, that is significant. For example, 14 to 12 or 13.5 to 8.2. This reflect the real blood loss and clinical impact. Now, the second number 8. If hemoglobin falls below 8 in a non-pregnant patient, that is critical level. At the same point, oxygen delivery to tissue is compromised and transfusion is often required. Now, the number third, 9. These apply to obstetric patient. In pregnancy, oxygen demand is very high. So the threshold is slightly higher. If hemoglobin fall below 9, these become clinically significant. So now you have the rule 2 for the drop, 8 for non-pregnant, 9 for pregnant. But here's the most important clue, transfusion. If a patient is transfused, okay, this is strong evidence of acute blood loss anemia because the body need blood replacement. This is what we call a strong clinical indicator. Along with this, look for signs: weakness, pallor, documented bleeding, tachycardia, hypotension, low hemoglobin, significant blood loss, iron supplementation after transfusion. Okay, the more indicator you see, the stronger your clinical picture become. So now let's apply this all in a real scenario. Post-operative case, hemoglobin dropped significantly, blood loss is documented, and transfusion is given. These all support acute blood loss anemia. So, in postpartum cases, if hemoglobin drops below 9, transfusion is given. Again, this support acute blood loss anemia. In trauma cases, massive blood loss, significant drop in hemoglobin, multiple transfusion, clear cut case of acute blood loss anemia. Let's connect this all to coding. Okay. So if the indicator are present but the documentation only say anemia, you can raise a query to clarify acute blood loss anemia. These improve the document coding accuracy and overall case representation. But also be careful in special situation. If a patient receive an auto transfusion, their own blood being returned, the logic is completely different because blood is not actually lost, it's just given again to them. Okay, in obstetric cases you need to see a change in treatment like transfusion or increased iron therapy to support the diagnosis. Now let's log this down. 289, drop of 2 hemoglobin less than 8 in normal cases and hemoglobin less than 9 in pregnancy. At transfusion you have a strong case for acute blood loss anemia. This is not about memorizing, this is about understanding what data is telling you. So yeah, if it helped, thank you for watching. Keep revising your core concept, keep sharpening your thinking because it's not about memorizing, it's about understanding the logic. I will see you in the next one. Thank you.